can, please, on our Facebook Live group, if you can like it and let us know where you're from, or you can also join us live here in our event page. That's great. Just let everybody know that where you're from, and let everybody else know that we are going live. Welcome everyone, and welcome Raviv Peleg.
Thank you. Thank you for having me. And nice to meet you all from Israel.
Yes.
Yeah, you start.
Raviv, well, we have a very interesting topic, a topic that I'm sure that is dear to many of us. It's Shiatsu, children and cancer. I mean, I've worked with cancer in the past before, and I was also involved with a foundation where I found out that the #1 cause of death for kids today in the world is cancer. So before we start, I want to pull up some stats that I saw that are quite shocking. And I'll just read it for you guys. Every year, globally, there are 300,000 children diagnosed with cancer. Every 3 minutes, somewhere in the world, a family hears a devastating news that their child has been diagnosed with cancer. So that's an incredible number. It's an epidemic by itself. And today we can learn how we as Shiatsu therapists can be involved in a hospital settings or working with children in cancer. And Raviv, he has tremendous experience here in working with some of the biggest hospitals in Israel. So Raviv, welcome. And maybe before we get into your work, if you can share with us your Shiatsu journey. How did you come to Shiatsu? Why did you choose it?
Okay, so I practice Shiatsu from the last decade, some 20 years or more. I used to work a lot with my body. I was an kind of athlete, and I'm running for jogging for all my life, and in those years I joined a group of physical theater. I don't know if you know, if I'm saying correct, it's a theater with your body, and this group practiced dancing, juggling, circus, acrobatic, acting, and I got really close to my body and to my conscious of my body. And in the same time, or just short time later, I was traveling in the Far East, and it started that I sat with people my age, and we looked on each other palms of the hand, and I started to touch the palm, and people said, "Wow, you have something in your hand," and "Wow, my headache is gone." And I didn't understood it so much, but when I came back home, I heard that I was interested in learning something, and I heard that Shiatsu is like dancing with your patient, and I like so much this sentence that since this day I'm dancing with my patients, and I love Shiatsu very much. For me, it's a way of life, and it's the sunglasses I wear every morning, and when I meet people, in my clinic or in the hospital, or when I use Shiatsu, it's a language for me. It's a way to connect by language that have a variety of options. It's not just talking, it's listening, it's observing, it's touching, but it's a language that I speak with people and I meet them eye to eye. And also I see myself as a kind of an architect, because I build bridges in my environment. I build bridges between the complementary medicine and the public health area, between me and my patients, between me and the doctors and other medical staff, between body and mind, and between me and my patients, if I said so already. And this is Shiatsu for me.
Beautifully said. You're a bridge builder. But you know, cancer is a subject that is not an easy subject to approach as a therapist. What drew you to work with cancer? What drew you to work particularly with a medical establishment? If you can share that with us.
Yeah, sure. I was led to work with in the children's oncology department because I had a good friend that was there before me. Actually, he opened the first door, and tragically he died. And
Hear that,
yeah, and so 10, 11 years ago, I didn't replace him, but I started to work in the same place after him. And since then, I'm there. I want to correct something, not to correct, but you said some things you said about cancer with children. So your statistic, I guess it's right, but the statistic in the oncology, the pediatric oncology world is about 90% of the kids is healing from the disease, about 90%. So so the department I work in is a very happy place to work. Sure, there is a lot of crying and pain, but it's a very happy place that the focus is recovering and health. And yes, when I tell people I work in the oncology department, they said, oh how could you? But I think in our as a therapist, I think the biggest blessing I can bless myself is to be significant to my patients. And when you meet people in these situations, I think for me at least, when I practice more than 20 years Shiatsu, I think I'm doing the simplest Shiatsu I ever done, but it's in the peak. It was never so high in the field of to be a meaningful to my patients and to the impact that that we receive from our environment. So it's I don't know how to say it, but it's a real pleasure to work in the oncology department. We feel really blessed, and we are very, very happy to come every morning to our workplace.
Beautiful. It is a blessing, and to be of service to those kids every day. I'm sure, putting myself in that situation, incredible feeling, and having a team around. the medical community looking at shiatsu, of course, not knowing what it is. Um, how did that dialogue started with, okay, let's see if we bring this unknown therapy. First of all, how do we explain to the doctors and specialists what is shiatsu therapy, and how do we show what it can do?
So when I started, it was almost 2 years after my friend went away. So nobody knew what is shiatsu. Sadly, I think we have to work hard to establish our place, because I think we will be one of the first to got forgotten. That's what I thought in the first years, and now we are in a different place. So when I came, nobody knew what is shiatsu, and there was no guidelines, no books, nobody told me where to go, what to do. So I sat in the first day in the library of the department, and I thought what to do. And my character is, I don't know how to sit down. I like to work. So I said, okay, I'm very confident with my shiatsu. So let's go to work. And I just started to work with children. I have a good connection with children. And the impact was very quick on the kids, of course, but also on the department and all the staff. And after, I think, 3 or 4 months, I was already in a situation that much more children want my treatment, and I can't go to everybody. And since then, the impact grew. So for your questions, it came from down. I feel at first came the impact, and the parents told the doctors, and the children tells each other, and it was very, very quick. And then I understood that I have to leave some footsteps after me. Footsteps, you said, when you go on the sand of the beach and
footprints, yeah.
Footprints. So I understood I have to leave some footprints after me, because shiatsu the impact is very, very good, but I thought it's not enough. And I started to learn some politics inside the hospital floors, and to develop many models of reporting what we're doing. Later, I develop researches that we will talk in a while, I guess, and articles and conventions and lectures, and trying. The goal was, my agenda was, first of all, I feel that shiatsu and complementary medicine, but shiatsu especially, is very, very suitable for hospital, for children hospital, even more, and for the oncology field, even more. I think it's really comes one with the other. So first of all, I wanted the people to know about the meeting between shiatsu and oncology. And second of all, I was overwhelmed with the amount of children that wanted me, and I understood very quick that I have to get bigger. I have to bring more therapists with me, and it's not easy. It's not easy to get the budgets for it and to convince the persons who get the with deciding about it. But slowly we grow bigger, and today we are 4 therapists. I'm just now I published 2 more needed 2 more therapists, so we will be I think 5 or 6 very soon, and we have a research coordinator. We are in a relationship with 12 centers in Israel, 12 other hospitals in Israel. We are doing 3 researches right now, and 2 more are in the designing stage, and we are very busy.
Fantastic. I mean, the medical community always wants to measure, especially when they, if they're creating budgets or giving money to an unknown therapy, they want to measure, they want to see that it works. What are some of the tools that are used in a way to measure the effectiveness of the therapy, and what it's been shown to be effective with?
The measurement is one problem, and to convince that the method, the Shiatsu, is the impact and not me as a therapist is also a big problem, because as one doctor told me in the beginning, yes, I guess you are doing very good to the children, but a good hug will give them also very good feeling. And I thought maybe to get offended by it, but I told him, you know what, you're right. A good hug is very good, and I think we are doing much more than a good hug, and it's gave me a motivation to try and prove it. So not like Chinese medicine, we don't have a placebo treatment. My method of Shiatsu is, as I said, is more the language and the leaning, and I don't like protocols, especially not in the oncology department. So I don't want to do research that said, okay, pericardium 6 with acupressure will work on the throw up situation, on the nausea. On the nausea. I'm not interested in that, because I understood very fast that even though I have a very good impact on the field of pain, let's say, the doctors won't, they don't say, okay, I don't use any more pills for pain, only Shiatsu therapist now, because sometimes the medicine works very good, very quick, and it's much more convenient to use. So I don't like to prove, especially that I work with pain or with nausea or with side effects. I want to prove it, but not as my main goal. I think what we are proud of is that we make the children go through the treatments of their disease more easy. The treatment of cancer with children takes from 3 months to almost 2 years of treatments, and they get the dose of the chemotherapy and other drugs is much more higher than adults. I don't know if you know, so they get very strong drugs that affects them very much. We have a very special place in the department because we are a very integrated part of the department these days, these years, because all the staff now knows what we are doing and the importance of the shiatsu, and we are like a mediator sometimes between the doctors and the children's, because we are establishing a very strong connections with the kids and their parents. We come from the good side, not like a doctor or a nurse.
Yes.
So the children loves us and they trust us. So I get to know the children and their supporting environment in a very deep relationship. I know what the name of the dogs. I know how they feel the same morning. I know what the name of their sisters and brother. I know what to expect. I know how to. Usually we don't need to speak to understand that the children in front of us what is feeling in the same day, and so the treatment is from really the first days of the diagnosis in a very hectic situations that the family just got just received the announcement, and we are a very stable stable rock for them in these days, because we enter straight forward to a situation where we don't have to explain who we are. I'm explaining, of course, but we are not something from the side in the department. It's not like a bonus. It's not. We don't have a side room or something. It's so much inside the regular treatments that the children get to their disease that we are one of the first people to meet the children and the family. And then we walk walk hand to hand with the children in better days, in worse days. Many times children will suffer a lot from side effects, from weakness, and there is times that they don't want to see anyone. They don't want to see the doctor, the nurse, the clown. They just put the blanket on their head and they want to disappear. And many times the only one who will have the green card to enter the room will be the shiatsu therapist. And because we have a powerful tool, we have our hand, and my hand connects to my heart, and we are very confident in what we're doing. So all this long answer came to explain that I want to prove my efficacy, that I'm effective in a wide field, but scientifically it's not a good thing to do. So the first research we started was quite a long shot. I didn't know really. I was learning through gaining
Trial and
forward.
error. Yeah.
Yeah. So and also the first rule I received from the manager of the department was no kids will you treat everybody. That they will in research we have 2 arms at least, because we want to prove one arm is effective. We have to have another arm to prove it. So he didn't want the other arm to be that children don't get a shiatsu. He said, you try to prove it, but everybody will get the treatments. That's what one of the things that proved me that we are very strong in the department. The other one was during the pandemic, the first phases, the first months that there was a big shutdown in Israel, I guess in many countries in the world, and many people in the hospital went home. Social workers, psychologists, art therapists, physiotherapists sometimes. Almost only doctors and nurses stayed. And the manager of the department called me and said, listen, you stay, you understand, yes? You will come to work, all of you. So we were the only therapists in the department, except doctors and nurses. And that gave me a lot of confidence of our place. So I'm getting back to the research. So the solution we found was to have a wait list control, meaning first arm of the research will receive shiatsu therapy from day 0. So I meet the children and I treat him. And the other arm of the research will be a wait list, meaning I meet them in the day 0 of when I meet them, and I tell them you'll get shiatsu therapy, but you'll have to wait 10 weeks to get it. This way, I have many fields to examine, to look on, because I have the 10 weeks that the children get in shiatsu against the 10 without. But also the children who is not receiving the shiatsu in the 10 weeks, they receive chemotherapy and other drugs. So it's not such a clean design of research. And also we have problems that children in the department tell each other, you have to do shiatsu, and parents and other, and so many kids in the waitlist arm ask us if we can treat them because they don't feel so good, and we didn't tell no to anybody. So we have a slow start for this research. Also, we try to prove efficacy in 4 fields: physically, side effects, mentally, and long term. And it was I don't know the word in English. It was
We'll say it in Hebrew. Maybe I can translate.
I'll tell you. Wait. Pretentious. It was pretentious to try to prove so much in scientific scientific. No, the time was not a problem, but we learned a lot from it. We learned a lot, and So the main field that we are working on proving scientifically is QL, is quality of life questionnaires. This is what we are trying now to prove, improving the quality of life of the children that undergoing the treatments in the department. And I think this is the most important impact we are doing. And I think this is what will bring more shiatsu therapists to the hospital and to other departments and to our department, because I think shiatsu therapists will not replace painkiller drug,
medication.
but medication, but shiatsu therapists will have a strong place in improving quality of life of patients in oncology and other departments.
Beautiful. Is some of the research been published? Can you share some of that with us?
No, we still didn't publish. It's a very long process, statistics, and many other steps. But we got a budget to each one of them, and this is also not an easy thing. So I hope soon in the, I don't know, I guess we have at least one more year until it will be published. So I hope to share you all when it will happen.
We'll look forward to it. Now, when you bring on board other shiatsu therapists, based on your experience being working there for a while and being one of the first ones, do you are you training them how to work, or supervising them? Are you giving them insights? Are you sharing your experiences with them and what you've learned?
It's a good question, because there is no frame to study pediatric oncology shiatsu. I went to learn in my first year integrative oncology for adults. So I have the basics, and since then I'm trying to learn every year more. Without connection to my work in hospital, I feel that I'm a student all my career, and I'm trying to learn all the time new things. For oncology, there is no school for pediatric oncology. And I received a therapist through the last years to my department, and I learned from the meeting a lot. As I said, now we published an ad to wanted 2 therapists. We have now a very strong process to receive the therapist, the new therapist. Yes, they have to come at least 4 times to join us in a work day to view what we are doing, because the meeting of a person, a therapist with the children in the department is not easy for some people. So first of all, they have to experience how they react to the situations. Our work is very dynamic. We have therapy room. How you call it? Cheder tipulim.
Yeah, a therapy room. Yeah.
We have a therapy room, but most of the work is in the beds of one of the departments, or on a chair, or any way the children will be. So the work is very dynamic. We are we walk a lot. We are in a good shape. We have to have strong legs. and thrown back. And so a person have to experience this firsthand and to see it closely, that if he thinks he can deal with it. And then in all the first months, a new therapist will work with one of the senior therapists, and before he will get his corner or a day of his own.
So he's been shadowed by a more experienced therapist for a couple of months before he gets a few days on his own or a part of the department there. Now, the kids, give me a range of the ages, or how young you're working on, and what's the age category?
So the age, sadly, I don't know if you know, but there are babies that born with the disease.
Yes.
They come out of their mother's belly, stomach with the disease. So we treat babies just a few weeks old with a very good impact on calming them down, stomach pains, mobility, and through the ages we have until teenagers or young adults whose age is 20, 21, 22. This is the maximum age that we work. So all the ages, every health situation, as I said, in the good days and in the worst days.
In the worst days. The treatments tend to be generally short because you have so many there, or is there a time frame that you work with, or is it just what is needed?
Yes, it's what it needed. And as I said, I'm trying that all my therapists will speak the same language, as I believe Shiatsu is a kind of language. So I see treatment as a meeting. So I know I have an impact on a kid who knows me very well. Even if I come in the morning, I put my hand on his shoulder and I say good morning. So this is a treatment for me because I stay near him, I talk to him, and we're trying to, sometimes change the change with children.
Perception or attitude. Yeah.
Yes, sometimes when children is suffering very much or crying, so all you need to do is like change the perspective with tools we have, and it's the first step of the treatment. And then every children by his need in that specific day, but the treatments are not short. They if I try to think what we meet some kids for 30, 40 minutes, sometimes even an hour and a half. We will be near one kid who really needs us. I don't have a time frame, and all the therapists have a free hand to decide how long they will stay near each kid. Also, we plan in the day in the morning by the list of the patients we get, but 15 minutes after we start, it's all changing. It's so because the doctor call us to get to children, and the physiotherapy will call us to join him to our treatments, and social workers and psychologists, and the parents will tell other parents, and the children will tell other children. We are very מבוקשים, מיכאל.
Very requested.
Yeah,
Very popular. Very popular.
Very popular in the department. We are very popular. Yes, and I statistically, and the children, the kids that will say no to us is very few. More than 95% of the children will agree to shiatsu therapy. I know you are all a shiatsu therapist, so you said, okay, who will say no to shiatsu? But even so, shiatsu and oncology is for a newcomers is not easy always to understand the relationship. I work also in other hospital in an adult oncology department, and there it's really surreal, the meeting between shiatsu and the patients, because not like the children department that is very live and very optimistic and very happy place. The adult department is totally the opposite place, and if you ask me what is more difficult for me, so the adult department is much more difficult. It's not difficult for me because, as I said, I really get a very special feeling in the significance of my meeting with the patients in the oncology department. So it's not difficult, but it's a place. It's a very quiet place. Quite sad. The statistic of is much worse than children, and the patients are lonely. Many times they are very lonely because an adult person that received the message that he have cancer, he feels that his body betrayed him, so he feels lonely from his body, and all the people near him, beside him, even the closest one, don't know really what to tell him, because I hope you won't come to a cancer patient and you said, it will be all right, it will be all right. I'm telling you, you can't do it. I tell always therapists that come to work with me, first of all, you have to know what not to say, not what to say. If you don't know, don't say it will be all right. Don't say we will get through it. Don't try to encourage him, because you understand why. And also many of the family members, even the closest one, don't know how to get close to a person because of all these reasons, and also they are all the time with צינורות,
drips and
yes,
hoses,
other stuff.
Yeah.
So the experience of the patients is very very lonely, and I come with my language and I go straight on and to put my hand. Of course, I'm telling him what I'm doing and everything, but no apologize, no excuses, no understanding. Hi, I'm a shiatsu therapist. I work in the department. I want to treat you. And they look like this, but they say, most of them say, okay. and the impact in there is even greater. It's like taking a glass of water to the desert and
Yeah.
you know, put it on the sand, because
giving it to a very thirsty person, a glass of water.
yeah, yes. So it's a real blessing for me to experience this this.
Yeah, the kids, the whole spectrum, the beginning of life and the end of life. It's incredible, and seeing the complete opposites of how working in a kid's environment is so positive and happy, survival rate is high, and then the opposite. Unfortunately, I don't know why they don't make the adults departments very happy too. But you're right, because I've been around that too, and it's exactly as you described it. Very very quiet, very sad, and tremendous fear by everybody around. Yeah.
But I want to say that we have a very good, not good, but strong place in the end of life field. This is something that you have to have experience, but the connection between shiatsu and end of life is very strong. I don't know really how to describe it, but because of the relationships we have with the patients and the confidence they feel with us, and the fact that we have a special language, so we have a very special place and moments with persons that is going to end their life. And also one field that we are very into and very strong in is rehabilitation, is when children finish the treatments and okay, now they are healthy from cancer, but they suffer from many side effects after long treatments of drugs, and they need rehabilitation in many fields, physically, mentally, school-wise. There is not a lot of public frames for it.
Aftercare. Yeah, aftercare for kids.
Yeah, so many kids come after they finish to meet us once a week, and we work together in bringing back the movement and the body, and we are very into this field also.
Fantastic. Is that post hospital? They come into the clinic privately, or is it still part of the hospital care? Or
well, children, when they still part of the department at least 5 years after they finish the treatment. So and we are a part of the department. We don't have to. So if I invite a kid, he just have to come. I don't need a doctor's note or anything else.
beautiful. Let's talk about the Kindergarten of Dreams. What is this project? Can you share that with us?
Yeah, sure. So I told you, I wrote you that I'm not the creator of the Kindergarten of Dreams. I'm just a therapist there.
Part of it, yeah.
It's a kindergarten that amuta. How you say amuta?
Amuta, that's a good word. I myself don't know how to say that.
Rega.
I'm part-time translator for him too today.
It's Google Translate say association.
Yeah, it's an association. That's right.
It's okay. So it's a
non-profit organization.
Yes, that's right. It's an enterprise of Amuta that's so that the children that finish the treatments of cancer, they still suffer many times, most of the times, from neutropenia. You know that the white blood cells are very low. So what's happened to my English? מערכת חיסון, מיכאל.
Oh, their immunity.
The immunity is very low for quite few months after they finish the treatment. So the doctor said you can't go to a kindergarten, to a regular one. So the children is in their homes. They are healthy, you know, but they can't go out and meet other children. So so they establish the first kindergarten in the world for children that finished the treatments. It's a lot of they thought of many things that have to be because you have to be very cautious in doing so. So it's a sterile place with special color on the walls, and everything is very
sterile and safe.
Very well planned to bring these children, and the kindergarten is very successful. There are 3 groups of ages, from 0 to 3, from 3 to 4 or 5, and from 4 or 5 to 6 when they start school. There is a big a lot of members, a lot of workers there, and also a lot of therapists working there, but I'm the only person with the complementary medicine field. Also, I started maybe the complementary integrative field over there. I love it. I meet people, the children in the room with the mattresses. We are mostly playing games. But playing games that is aiming to strengthen the body and to mobility of the body, and to connect between the children, to get them together with each other, because many of them come very frightened and lonely also. So I enjoyed a lot my work there.
Where you get to bring your love for physical theater, right? That's how everything began.
Yeah, that's the place. That's the place.
Yeah,
that's the place. The children really love what we're doing, because and the other people who work in the same day that I come always outside the door to see why everybody is laughing and screaming and shouting, and so yeah, that's Shiatsu for me is to be very gamish,
flexible,
very flexible, and to work with what you have. So if I want to work on a mobility of the hand, I create a game that's moving the hand. So in this place, I create many games and exercises, and it's going very well. I'm there since 2014, so quite many years also right now.
Incredible. I want to leave some time here for people that have joined us to maybe add into this conversation. I have maybe questions for you. So if anybody here wants to ask a question on our Facebook group, just raise your hand and unmute yourself. Somebody left a message here. The Shiatsu world needs people like you who demystify the work of Shiatsu and Cancer. Thank you so much for this excellent feedback.
Thank you.
Anybody has a question for Raviv here or would like to add? Go ahead, Barbara.
Do you sometimes work with fairy tales or images or stories connecting, combining it with Shiatsu?
Yes, we all qualified in a guided imagery. It's a very important tool in our toolbox, and so not I don't call it fairy tales, but I work a lot with images, and we use it a lot. Yes.
Because I'm just working on this field, and maybe I'd like to contact you sometime and ask some more questions.
I'll be happy if anybody want to contact me to ask questions. Mihail will publish my email, and if you come to Israel, please come to visit me and watch the work we're doing, because there is nothing like experience it firsthand. So really, if you come here, please come and visit. You all invited.
It's very generous and a great opportunity, I'm sure, for many Shiatsu therapists. Another reason why to visit beautiful Israel there. Any other questions or anything that anybody would like to add? Susie, you worked in a hospital in Napoli. You were curious to hear what Raviv had to share with us. Do you have any comments or feedback?
I don't have question. I just an observation, because I after many years I worked in the hospital in Napoli, in Naples, around, I remember well, 2001, something around in the beginning of 2000, and we had the same issue. I mean, to describe an holistic approach into to push it into the Cartesian theory, you know, to know the particular, because Shiatsu is it's working with the system and not with the single, with the stomach and with the kidney. So it's really difficult to understand that the good result is from the holistic way of the body that works like an orchestra, you know, all together. And they are just pushing for result in particular. And it's really, really difficult to do this. I understand, because we had the same, and in Naples they just closed the department because we were getting good results, and they shut it down. So we had to finish with Shiatsu. It was not possible anymore. But maybe I had a question regarding the approach, the therapy. If you ever thought to use the extraordinary channel, in particular with the newborn, or with the children, with the, you know, in the beginning, the first 4 or 5 years, and in general, because the extraordinary channel are the roots of the system. It's like the egg, the embryo. So it's just for curiosity, if you ever thought of working with these channels.
A good question. Thank you, Susie.
So thank you for the questions. First of all, for the scientific field. Just a few weeks ago, I'm trying to be all the time on the list of the journal club of the department. The journal club is once a week, all the doctors meet, and they are processing, reading researchers from around the world in their field. So every year I come once to a journal club, and so the last time, because I have a very good relationship with many hospitals in Israel, and the complementary medicine field is gaining bigger. So we have a lot of work in Israel and in the world about proving what we do, and maybe in a few in another time we will do a meeting just for this, because I have a very good knowledge now, and I show them just from the last 2 years very 7 or 8 very important researchers in our field. It's very interesting subject and very big. As for the extraordinary system of vessels, personally, I like it very much. I learned it from my good friend Chris McAllister, and yes, I find the connections to newborn children. But as I said, I'm trying not to get any system or any protocol to our work. Actually, we want to start and change it a little bit, and start to have more knowledge as a Chinese knowledge or a Meridian knowledge, to start to collect the data also in this field in a better way, because we were very focused to collect the data from the Western side, and our treatments just so we now we are looking more into in a Chinese way, or meridians, and try to see if some things is coming back again and again, and so I don't have a better answer than this right now.
Thank you, Raviv. Another comment here:
Thank you.
inspiring work you're doing with children and cancer in Israel and the hospitals, incredible, and I love how you are bringing creative ways to engage and also do research. Very encouraging for all of us.
Thank you.
So anything to leave us with, Raviv? Any inspiring words, any encouragements, anything that you want to share with the global Shiatsu community?
I haven't thought of this kind of words. Well, you know, I'm doing now Shiatsu for many years, and every day, at least one person will ask me, what is Shiatsu? And, you know, I don't have an answer. I don't have a good answer. I don't have a good answer for it. Every time the answer is changing. I think a Shiatsu therapist will understand me, because I practice Zen Shiatsu. So the first rule of Zen is you can't explain what is Zen, because then you're doing the opposite thing of Zen. So, but I think we have to wake up a little bit, and to try to understand ourselves what is Shiatsu, because I see around me that Chinese medicine is very strong, because they have a strong backbone, a strong personality, and a Shiatsu therapist is always walking on his footsteps, you know, almost apologize. So I don't want to apologize. I don't have a good answer what I'm doing. I don't know. I know I can talk about it for one more week, but I can't explain in a few words what is Shiatsu. So I think we have to get out with our chest very strong, and to be proud of what we're doing. And maybe to one day we will succeed to explain what is it that we're doing, maybe.
Well, thank you, brother. Thank you for everything that you're doing, and
Thank you for
inspiring
inviting me,
words.
and thank you for listening to me.
Yeah, it's incredible work that you're doing, and it gives you, I can see it gives you a lot of joy, a lot of purpose. And I'm so happy for you and what you have accomplished to do. And thank you for the invitation to our global Shiatsu community to come and visit and experience the work firsthand too. That's very generous. And thank you everyone who joined us for another great episode. I hope all of you have a great weekend. Wow, this was a lot for us, and thank you for sharing.
Thank you all.
Thank you.
Thank you. Goodbye.
And thank you, Michael, for organizing all this.
Can you leave
Yeah.
the email? Is it possible, Raviv, to
Yeah,
contact
yeah.
you by email?
Yeah, I'll post the email and his contact info on our Facebook page, okay?
Thank you.
Great, thank you.
Okay.
I'm writing
Okay.
it now in the chat box also, if you want. So I'll write my email. It's okay, Michael?
Yeah, of course.
Thank you.